Hi, everybody. I just wanted to talk a little bit about ADHD since we're going to be opening the telehealth portion of the practice soon, and it's becoming the end of this school year, which is a great time to do an evaluation for ADHD because the teachers know the children really well at this point. And so any concerns that we have for ADHD, we can do evaluations this time of year. And if we are considering doing any medication, this summertime is a great time to see what kids are like on or off medicine. So let's just talk a little bit about what the process of diagnosis looks like. How do we do it? Who needs to be involved, etc. So first of all, who are we going to diagnose? What do we need to look for? So, many people know the obvious signs of ADHD, the hyperactivity, and that's typically, I think the classic kid is a boy who's bouncing off the walls. But that's not always the case. And I think what we are not doing a good enough job of is diagnosing the kids who are what we call the daydreamers. So that's typically the girls who are often just, staring off into space, just a little lack of focus. So it's not that they're touching touching things, getting up in class, talking too much. It's just they're kind of just not focused. And so we often hear that, she's not paying attention. And we see that a little bit more in girls, that type of ADHD. Not that there can't be that type of diagnosis in boys. And they tend to get, the frustration from parents is all she has to do is pay attention. And it's not something that's under their control. And I think we have to remember that. Then there is the impulsive kid. So it's like hyperactivity, but it's just like they just can't help reaching out, touching something, or they just can't help answering the question without raising their hand. Get a lot of frustration from teachers over this because they think, if they're not familiar with ADHD, these children tend to get a lot of conduct remarks, and they can be ultra smart children. So their grades are great, but their conduct grade is not great. So they're talking out in class, might have the right answers, but they just can't help blurting it out or talking to the kid next to them. They're not necessarily hyper. They're just impulsive. They say everything that comes to their brain. And I think it's tricky when kids have great grades because we assume that because they're doing really well in school, that there cannot be an executive function problem. However, with ADHD, what ends up happening is there are other issues that the ADHD is causing, and that could be social issues, could be conduct problems at school, and because they're getting poor conduct, they might be getting in trouble at home because parents are getting hard on their kids saying, why aren't you getting it together? I don't like seeing poor conduct. And of course, that same conduct is probably a problem at home. The kids are not listening. They're not following through on things at home. They're being impulsive and saying maybe inappropriate things because it just comes out of their mouth. It can be really hard to understand that when kids are getting good grades. For the inattentive kid, they just forget. They forget to put their shoes away. They forget to brush their teeth. They forget to do the thing you just told them to do. And it can be hair pulling as a parent. So again, it's not just about what their grades are, it's more of the behaviors that you're noticing. And as a parent, and I am one of these parents, I have a kid who is like this, you can be doing all of the right things to correct some of these behaviors, but unfortunately, their brain is doing things that they can't control. So the typical things that would work for what we call the neurotypical kid, the ADHD kid, it's not going to work for. So, if any of these things are making sense to you, like that's my kid, then what we need to do is take a look and see if any of the tick boxes for ADHD applies to your kid. And then, of course, people are like, I don't want the label, I don't want medication. And the label is just there so that we can help intervene from maybe a therapy standpoint. And I don't necessarily mean you have to talk about your feelings. I mean, how do we organize better? How are we going to, get from point A to point B during the daytime? That is what we mean by therapy, like as in functional occupational therapy. And then, if the school is becoming a problem and they're punishing your kid or they're overreacting to something that's going on, then we can create like a 504 plan so that, your child can have some protection and some help. And it's super helpful. And that's why the diagnosis is important. And remember, these diagnoses are not for the world. They're for you and whoever needs to know. Medication is necessary if medication is necessary. And these are not addictive medications. I think that's really important for parents to know. I think they think of these medicines as, drugs. Like, it's not an addictive medication to the ADHD brain, and we can talk about that later. It sounds very scary to put your kid on a controlled substance, but for the ADHD brain, it is a very different interaction than for the non-ADHD brain. If I, non-ADHD, were to take one of these medications, it would do very differently than for my child who has ADHD. So you just have to think about that. It's not something we definitely jump to for every patient. Sometimes they just need some occupational therapy and some interventions from their teachers and counselors at school to say, here's what we're going to do in the classroom. And here's how to parent this child of yours differently from your other children. So, if you have any concerns, if you feel like one of your kids fits this criteria, there's some forms on my website. You can print them off. There's a parent form, so one for each parent. And or any caregivers. And then there's teacher forms, and it depends which grade your kid's in. So, if they're in middle school and they have multiple teachers, then you try to get their main teachers. If they're in grade school, it's their main teacher, right? We don't need the PE teacher, If your kid's in a very active sport like cheer, it might be helpful to get somebody like that to do it. But not like their rec coach. We're really just interested to see if this is in multiple aspects of their life, or if you're just seeing it at home, if they're seeing it at school. So take a minute, think about this. This is certainly something that we spend a lot of time talking about in the office through telemed, etc. So I hope you enjoyed this past weekend, and spring is starting this week, so look forward to hearing from you all. And remember, April 1st is when the telemed visits start for ADHD, anxiety, depression, etc. All right.